field of nursing in particular, you don't get to decide who you want to see as a patient. You have to care for every single person with all of their culture, with all of their lived experiences. Cultural humility, the framework itself, actually was developed out of healthcare. It was developed by two physicians who are saying that while they are healthcare experts, that if they don't treat the whole patient, then they're not still treating even the problem or the symptom that is before them. And so if we think about what it means to treat someone with pneumonia, then we've got to think about who is the person with the pneumonia, and will they have either the resources to come back or to get the medication or to eat the right foods that's going to actually help them in their care. We have to consider all of that. And if we can't do all of that, then all we're doing is treating a symptom, which means that that problem or that diagnosis may be back. Cultural humility really is a framework for how we can do diversity, equity, and inclusion to bring people into the fold. It really has a lot to do with self. Cultural competency, the thought was for many years that we focused on how we learn about others. And cultural humility says that while that's important, also recognizing our own self-work and understanding the power dynamic that exists between people is what really makes the work more achievable. And honestly, it also makes the work more applicable to various disciplines. These discussions are extremely important for a couple reasons. How do we connect with other human beings is through our intentional relations. And so when we have the chance to get together and have real conversation and talk about who we are, it's life-changing. We make connections to other human beings. Institutional accountability. I mean, this is the last tenet of cultural humility. And in the work that I do as a consultant, yes, I am often brought in to do a workshop here or a training here, but to see Avant taking this to a whole nother level. You know, for me to start with the leadership team and then now kind of with the CNOs, and to say this will not be a one and done for us. We want this to be institutionally impactful, and that makes a huge difference. It says a lot about the company and the values that they say are important to them, and that it then be lived out within the clients and also the nursing staff that they are working with.